Good morning, everyone. Okay, so good morning, everyone, all you Sebamed fans and loyalists. Happy to be here on a Sunday morning, and I believe all of you, at least in metros, are stuck at homes in curfew, but be safe. And I'm Dr. Sunaina Hameed. I'm a Bangalore-based dermatologist. And to give you background about me, I graduated my MD Dermatology from Kasturba Medical College, Manipal in 2008. And now I have my own private practice. It's called Skin Health Advanced Dermatology Center. It's based in Whitefield, Bangalore. You can reach me on my Facebook page, Your Family Dermatologist, or you can learn more about me through my website, www.drsunaina.com. Today I have joined to speak more on acne and rosacea. Any doubts and questions you have, any myths you may have, whatever you may have wanted to ask but didn't know whom to ask or where to ask, or you are searching for information at the wrong places. So I think gone are the days when people thought of acne as a problem for teenagers. I think most of us now know that acne can continue well into adulthood. And in fact, many people suffer from acne for the first time in their lives as adults, even though they never had acne in childhood. And I think gone are the days when people believed acne was a problem for, teenagers, or it's a normal or passing phase. I think now people do understand that acne can be a chronic condition, and therefore treatment also tends to go on for a longer period of time. And I believe now it is also understood that acne is not a cosmetic embarrassment alone. Acne is very much a medical condition. It is much more than that, just a cosmetic problem. And it can severely affect a person's self-esteem. It can lead to a lot of bullying at school. It can affect relationships. It can, in certain jobs, it can affect your career prospects as well. And with time and with treatment, your acne can get better, but it may leave scars. And with treatment, scars can also get better. But, the thing is, even the trauma that you went through in the most vulnerable formative teenage years of your life, that pain remains in people's heart. Now with rosacea, I think there's less information with rosacea. People have not even heard of it many times, probably because in India rosacea is not so common compared to white skinned people. And secondly, I think a lot of people still have the tendency to go to family doctors and general physicians for rosacea, or to go to homeopaths for those things. And so many times it is misdiagnosed as acne and treated as acne, even though it's not acne. Or many times it is misdiagnosed and treated as a skin allergy. So it is treated with allergy creams, which are usually steroids. And the thing with steroids are, the longer you use steroids on rosacea, it is going to come back even more worse and even more fiercely. So, okay, so the first query I had with this is about diet and acne. So, okay, that's a good question, because even 20 years back, the Bible textbooks of dermatology used to say that, most likely diet and acne have no relationship. But now we know that that's not true. So the thing with diet is high glycemic index diet, which basically means food that is high in sugar. So that is not just white sugar, but even white rice, too much of pasta and white bread, that is known to make acne worse. So you have to switch to maybe, replace sugar with jaggery or honey and switch to brown rice, cut away from maida. Too much of dairy can also make acne worse. Curd and buttermilk is relatively better, and you can switch to soya milk instead of paneer. You can have tofu. Definitely cut back on the ghee and butter and cheese and cream and paneer and mayonnaise. Oily fried food can make acne worse. Sometimes people do say that nuts tend to make their acne worse. On the other hand, constipation is another thing that leads to chronic acne. And many people with bad acne are chronically constipated. So a lot of water, a lot of fiber will help this condition. So again, individual experiences, subjective experiences can be there. Some people say that mango makes my acne worse. Again, it could be because mango is very high in sugar. Mango and beetroot, among fruits and vegetables, have a high glycemic index. But otherwise, in general, fruits and vegetables are generally considered good for acne. And anything that's rich in vitamin A is good for acne. So that's all your carrots and your papaya and your pumpkin. Those are goods. Someone was asking, do nuts aggravate acne? Generally, no. But again, if someone has repeatedly or consistently experienced that every time they have nuts, the acne is getting worse, then you may have to cut down on your nut intake. Whey protein is another thing. A lot of people, they've heard that, you have acne because you're overweight, you need to lose weight. But when they go to the gym, the trainers tell them that you need to get more protein, and the protein is usually in the form of whey. Whey is actually from cheese, and a very cheap quality cheese. So whey protein concentrates can actually end up making your acne worse. So if you are working out and you need to take more protein, either get your protein from natural sources, your sprouts, your lean chicken and fish, or your egg whites, or switch to vegan sources like the vegan pea protein powder. That could be a good source of protein for you. So the other questions that keep coming is, someone asked a question on sunscreen, which is again a good query, because a lot of people have seen that sunscreens itself tend to make their acne worse. But there are a lot of formulations now which are suitable for acne prone skin. And usually these are formulations that contain dimethicone or silicone. So silicone is an ingredient that is added to moisturizers and sunscreens and give it a more matte finish or a more powder-like finish. So if in doubt, you can always consult a dermatologist. Most people with acne will eventually have to meet a dermatologist, not just for treatment, but even to get, information on which is the right face wash for me, which is the right sunscreen for me. So sunscreen is generally helpful because acne, even if you're not in the habit of pinching and scratching it, it will still leave some marks and scars. And if you are out and about in the sun, using a sunscreen can also give some protection against bad pigmentation. So there are a lot of sunscreen formulations now suitable for acne prone skin, matte finish sunscreens with dimethicones. So they are suitable. You will still be able to find a sunscreen that is suitable for you. There's one query on relationship between dandruff and acne. Yes, this is a very commonly asked question. A lot of people with forehead acne will have dandruff as well, and they're convinced that it's the dandruff that is falling from my forehead, that's from my head, that's causing acne, or dandruff that falls from my head that is causing acne on my back. See, the thing is, most people who have dandruff will have acne as well, and vice versa. But treating your dandruff by using anti-dandruff shampoos, the dandruff will get better, but the acne is not going to get better. See, the reason is because dandruff and acne happen side by side because both of them are caused by the same factors. They are both caused by hormonal changes, hereditary factors, and excess oil production in the face and the scalp. So you will have to treat dandruff with anti-dandruff shampoos, but you'll also have to treat the acne simultaneously. Treating your pimples will not automatically clear up your dandruff, and treating your dandruff will not automatically clear up your acne. On the other hand, a lot of girls who have acne on the forehead, they tend to have a fringe haircut to try to hide it. That makes things worse. So if you have forehead acne, keep your hair away from your face. Maintain scalp hygiene. Shampoo regularly. Shampoo at least on an alternate day basis. And if you're an athlete working out, sweating a lot, shampoo on a daily basis. Avoid you leaving oils on your head, especially full day or full night. So the longer you leave oil on your scalp, not only will it make your dandruff worse, it can lead to little oily like acne-like eruptions on your scalp as well, which are known as folliculitis. So they can be painful, they can be itchy, and they can also lead to hair fall. Other hints and tips with dandruff is the same with styling products. So if you do suffer from forehead acne or dandruff or teeny tiny painful pimple-like eruptions on the scalp, you shouldn't be using styling gels or creams or hair waxes or pomades. You should leave your scalp free. On the other hand, if you feel with regular shampooing and without applying, if you feel that you're shampooing regularly and then you're not applying any kind of oil or a hair cream, if your hair is feeling very dry, you can use a rinse-off conditioner. So rinse-off conditioner does exactly what oil is supposed to do. It keeps your hair soft and shiny. Especially women with long hair will need some kind of conditioning so that the hair doesn't get tangled, so that it doesn't break or split. But at the same time, it doesn't leave any residue on your scalp. Okay, so let's see. Okay, lots of waves, lots of joints. Yes, again, this query about whatever I eat, it affects my skin. That's true. I mean, good skin, good hair is a reflection of good health internally. So healthy eating, it does matter. So everything cannot be, just skin creams and beauty creams. It will, even if you see celebrities, it's not just makeup and good lighting. Everybody does their exercise. Everybody is an expert on clean eating. They will not touch junk food. But having said that, sometimes you cannot fix your skin. If you suffer from really bad acne, you cannot fix your skin only by clean eating. You will still may need a dermatologist or a doctor to help you. You may still need medication as well. On the other hand, a lot of people who have acne also suffer from bad hormone imbalances. Now, everybody who has acne does not necessarily have to suffer from a hormone imbalance disorder. But it just means that for genetic reasons, your oil glands are a little sensitive to hormone fluctuations. And hormone fluctuations can happen because of stress, because of lack of sleep, because of a sedentary lifestyle, if you don't get any exercise at all, if you've been putting weight, if you're constipated. So multiple things come together to cause acne. You have to think acne as a chronic lifestyle disorder, similar to BP, high BP or blood pressure or diabetes. So it cannot be just medication. If you're a diabetic patient, you cannot just take medication and ignore diet and exercise. It's the same with acne as well. So diet and exercise will help with, and clean eating, healthy living will help with your acne. But it may not always be a replacement for medication and the right skincare. So coming to skincare, what is the skincare to be followed when you have acne? And again, we get generic queries either through email or through Facebook that give me the best face wash. What is the best face wash for acne? What is the best sunscreen for acne? There is no such thing as the best face wash for acne. It really comes down to what is your particular skin type, what kind of acne you have. There are 4 different grades of acne and many people have overlap between many different grades. So for instance, if your skin is really oily, it is secreting and squeezing and squirting out oil, and your main problem is a lot of blackheads and whiteheads. If that is the case, you need a salicylic acid containing face wash. On the other hand, many people have the main problem in their case is not oiliness, it is just a lot of redness, lot of inflammation and pain. In that case, salicylic acid may actually end up making your inflammation worse. You may need more of an antibacterial face wash. Some people need benzoyl peroxide for face washes for their inflammation. Many other people who have acne actually have dry skin. So not everybody with pimples will have oily skin. So in that case, the formulation changes. You will need something that is meant for sensitive skin with acne. On the other hand, rosacea is a completely different condition. It comes in the category of sensitive skin. Your eruptions look like acne, but there's so much of sensitivity that you have to use a soap-free, foam-free kind of a face wash. So even with face washes, there are huge variations. If you have pores, if your job is such that you're constantly exposed to pollution, again the formulation of face wash changes. So these kind of questions, that best face wash, that best sunscreen, there is no such thing as a best. There is something called a customized skincare that a doctor can only give after meeting you in person, after a detailed history taking on your skin type, your habits, your hormonal issues, your lifestyle, and then it is customized. Once you figure out what suits you, you need to stick to that skincare and don't keep changing and rotating. Yes, skincare may change according to the weather. If you're staying in Bangalore, for instance, and a certain skincare works for you, and then you need to move, suppose your company posts you to Europe, the skincare may not work there in that weather, then your skincare will change. Similarly, with age, it changes. You had acne as a teenager, you had a certain skin type. Post 30, post 40, again your skin type will change. Then your skincare will also change according to that. Again, there are certain myths with cleansing. For instance, many people have heard that, or they believe that if you had acne, I was told that for pimples I just need to wash my face multiple times in a day. I was told that you just need to wash your face 6 or 7 times a day. There is a variant of acne called acne detergicans. That is acne that is just caused because of repeated washing of the face. It is just going to waterlog your pores and lead to even more acne. So generally, skin doctors will say if you have acne, washing your face 2 times a day is more than sufficient. And if you're very sporty or athletic, you're actually playing sports, out in the sun, doing a field job, sweat that profusely, then maybe 3 times a day. But excessive and repeated washing is not going to fix any issue. The other thing that people believe is, I have really oily, acne-prone skin. I don't need moisturizer. That is not true. You may need less moisturizer. Maybe you need moisturizer alternate night basis, and you'll need a water-based moisturizer or moisturizers that contain ingredients like clay or silicone or kaolin that actually have oil controlling properties. But everybody needs a moisturizer. Without moisturizer, your oil glands will just go into hyperdrive. They will just start squirting more and more oil to start compensating for environmental dryness. And without a moisturizer, your skin will tan faster, your skin will age before time. Rosacea is again a condition where there are many triggers, and even with acne, you have to figure out what triggers your acne, you have to figure out what triggers your rosacea and learn to manage that. In rosacea, the food that triggers rosacea is different. For instance, in rosacea, the main food items that trigger it is spicy food, alcohol and caffeine. So caffeine, especially, everybody knows coffee contains caffeine, but even tea contains some amount of caffeine. Colas contain a lot of caffeine, energy drinks contain caffeine, dark chocolate contains caffeine. So food is again plays a major role with rosacea. Okay. Now one query is, my face is dry, but when I apply moisturizer it becomes too oily. Yes, because your moisturizer is the wrong kind. So most likely your skin is not dry, it is most likely an oily sensitive skin. I don't think you have dryness, you have some kind of a sensitivity or a mild eczema which you haven't figured out, or the moisturizer that you're using is not suitable for your skin type. There are moisturizers that hydrate but don't have that slip or that creaminess of the moisturizer that you're using. I think ideally you need to meet a dermatologist. When you go to meet a dermatologist, you should wash your face and meet them 2 hours later without applying any cream or any powder. Then they'll be able to assess it well. So most likely, I think you have oily sensitive skin and you need moisturizers meant for oily sensitive skin. And what you would need is something without any color, without fragrance and parabens, and dermatologically tested recommended product. And you should stick to the same product. You shouldn't keep changing products, and you should completely avoid toners. Toners will not suit your particular skin type. Okay. So other things, cosmetics and acne. That's another common query we get. If I have acne, the common tendency is my pimples leave a lot of marks. They make me self-conscious, so I tend to use makeup to hide my marks. But then the more makeup I use, I get more pimples, and then I leave more marks, and then I tend to use even more makeup to hide it. So how do I balance between this? So first and foremost, ideally when you have acne, you should try to avoid using makeup on a daily basis. Now some people say, I am in a job or a profession where that is not possible. Either I am in the beauty industry or I am in hospitality. My job requires me to use makeup on a regular basis. Now, and I have acne. How do I work around this? So there are a few things to keep in mind. One is, use a moisturizer that is suitable for your acne prone skin. If you don't know what is suitable for my acne prone skin, since I have not examined you in person, please meet a dermatologist, especially a dermatologist who works with acne, qualified or experienced enough with acne prone skin. Get advice on that. After you have used your moisturizer, makeup goes on top of it. Use powder based makeups. Don't use cream based makeup or oil based makeup or even powder based makeup. If it says souffle or cream finish, foundations, these usually are heavier cream based or oil based. Second thing to keep in mind is avoid multiple layers of makeup. So that is a problem. People say that unless I use multiple layers of makeup, it doesn't hide my scars and blemishes. You want to clear up your scars and blemishes. That can only be possible if you meet a dermatologist and treat it. Hiding it with makeup is not going to solve any problem. It is just going to lead to more scars and blemishes. So the trick here is meet a dermatologist, start treating your acne and marks. So you will need less and less of makeup. You need fewer layers. You can get away with powder based makeup. Don't do baking of your makeup. Don't use multiple layers. Never leave makeup for more than 4 or 5 hours wherever possible. Try not to use makeup on a daily basis. It is particularly difficult in a pandemic because using makeup under a mask is going to cause even more problems. Never go to sleep with your makeup. Always remove your makeup first with a makeup remover. Use a water-based makeup remover and then remember to wash your face with the right kind of a anti-acne face wash. Makeup remover is not a face wash or a cleanser. That is a common mistake that people make. Second thing, highlight your